Hey everybody, my name is Matt Thacker. I'm the lead faculty for the Pediatric Emergency program, and I'm excited to share a little bit more info about what we do. Thanks, Julie. So who is the Pediatric Emergency program for? I think here at BCIT, we kind of have, we promote it as basically anybody who has a passion for children and working with children as a nurse. Obviously, we really appreciate the context being in an emergency setting, but especially so, it doesn't need to be a specialized emergency setting. You don't need to work at BC Children's or at Surrey Memorial for this to be applicable for you. As we all know, children will show up at any emergency department in BC. So if you feel like you want to increase your knowledge and skills working with children in emergency departments, if you want to increase your knowledge and skills with acutely ill children as well, and maybe you don't work in an emergency department, this would also be beneficial to you because we look at a lot of different presentations and how to manage kids when they get sick. So don't think when you hear pediatric emergency specialty that you have to only work with kids. You're going to work with kids in any emergency department and in many different settings across BC. So it's really, really important that if you feel like that would be an area to improve on, that we're for you. You can be a registered nurse and practicing. We also have pathways for undergraduate nurses to start taking some of our electives and some of our courses before they actually enter the workforce. So what do we do in the Peds Emerge program? What are some of the things that you can expect? So obviously, we know children are very different than adults. You're going to learn how to kind of manage many different presentations as well as many different ages. I mean, if anyone has children, has worked with children, you know, a 2-month-old and a 4-month-old are totally different beings. So we're going to prepare you to manage the child kind of across that continuum and to kind of give you, I mean, we say this lots during the program, but give you tools in your tool belt to kind of address, assess, intervene, and kind of manage these really sick kids. So there's tons of presentations on that continuum, and we really build on concepts. We start, introductory, kind of introducing you to emergency nursing, introducing you to the pediatric patient, and then we build nicely on that as well, going all the way up to kind of trauma management and trauma interventions for the child. So again, we don't just push you into the deep end, we set you up nicely and we kind of build on concepts as we move through the program. And I think one of the things that we've really emphasized in our program, and again, if anybody has even tried to approach a child and talk to them, that communication is a big part of what we do as pediatric emergency nurses. So we focus a lot of the program on that. How can you approach a child as a nurse and make sure that your assessment is successful? How can you communicate with the family? Family-centered care is a huge part of pediatric nursing. So really making sure that we have that understanding and that knowledge. But in building on that, not only communicating with the family and the patient, but communicating with the team in the emergency. It's a very dynamic work environment. You're going to work with many different professionals with many different fields. So how do we communicate, systematically and kind of advocate for our patients? Because as we know, children are very vulnerable. They're some of the most vulnerable patients you'll see in the hospital setting, especially in emergency. So how do we as nurses empower our families and our patients? And how do we advocate for them in their times of need? So communication is a big focus for us. And this is through lots of feedback from nurses who, are kind of uncomfortable dealing with kids. The first thing we always say is, I don't know how to approach them. I don't really know how to communicate with them. That's kind of a scary thought to me. So we really give you those tools in your toolkit to feel confident when you approach kids and when you approach families that you're going to care for them, following best practice standards and things like that. So what is our program? So some of the highlights that we want to mention, like some of the other programs that you've heard from already, we're the only one in Canada that talks about pediatric emergency specifically. So we're very proud of that. And we're also very proud that it's recognized across Canada as a specialty, as a certification. This is different than some of the other education out there, some of the other training that you might see, where it may not be recognized as formal education, but that's not the case for us. It is widely recognized across Canada. So if you end up moving or working in a different department, you'll still get credit. You'll still get that acknowledgement that you've had the certification. So that's really, really important for us. We do have multiple different methods of delivering our content as well. The distance course method can be taken across Canada and the world, really. It's a distance, very asynchronous type of model, and you can work on it at your own pace. We have 2 prerequisite courses and 3 theory courses. So as you work on them at your own pace, it takes probably about 2.5 years, because each course takes about 3 months as you kind of tick your way through it. And we offer about 144-hour clinical experience on top of that. And we work with you to make sure that that clinical experience is exactly what you want it to be. We have great relationships with many hospitals across Canada, and you get a really, really amazing experience no matter where you are in the country, which is amazing. If you are closer to home in BC and the Lower Mainland, you can come to us in the compressed time frame. It'll take just over 3 months, and you come to us from wherever you're working, and you get a kind of crash course of all the information over that 3 months, and you get the 2 prerequisites on your own time. And then that 3 months, you finish those 3 theory courses and the clinical component, and you'll finish that at both BC Children's Hospital and Surrey Pediatric Emergency. So again, great kind of diversity in the patient populations, the acuities that you're going to see, the people that you're going to work with, and we're really proud to kind of have that relationship with them. So two different models, and again, kind of touching on what I said earlier, if you are an undergraduate, we do have a model where you can start ticking away some of those prerequisites while you're in your BSN, so that once you're finished, you can come to us and kind of finish the rest of the course off. So if that's something that interests you as well, you can also reach out for that. So many different options, many different ways to kind of increase your PEDS emergent knowledge. And yeah, I think we're going to have a video now for one of our past students.
So thanks, Kyle, for coming out today. I know it's super busy in today's world, but I appreciate you taking a couple minutes here to speak to the program. So if you'd like to maybe just say hi and introduce yourself.
Perfect. Hi, my name's Kyle, and I previously worked in the emergency department at Children's Hospital. And currently I am a coordinator with the Vancouver Pediatric team and a clinic nurse with Insight.
Great. Yeah. Well, thanks for coming, Kyle. Thanks for sharing all of your insight. So, thinking back, you took our program a couple of years ago now. So just thinking back to that time when you joined, why did you decide to, take the leap and join the program, and what did you envision for yourself?
Yeah, the emergency department is one of those places where you get to be the jack of all trades, master of none. And it's a controlled chaos, and it's a perfect mix for getting a lot of things accomplished, but it doesn't really give you that opportunity to take a deep dive and to really understand and hone certain skills. So what I was really looking forward to with the program was the opportunity to consolidate my knowledge and my practice, and to get into that simulation world and prepare for those one in a million cases that PEDS is known for.
Yeah, I'm so glad you spoke to that, because that's a huge advantage of taking the time in these programs, right? Is to the ability to be a student again, and to be vulnerable, and to learn all these things that we may not, especially in emergency, have the time to actually understand some of the things that we're seeing, because it's quite chaotic. So I appreciate you saying that. That's amazing. Yeah. So reflecting on your time at BCIT, what did you like about the program? What did you value in it? Reflecting on those 3 months.
Reflecting back on it, I really valued my time with the instructors. I felt coming into this experience, in some ways I felt like a nursing student all over again, but then working with my instructors and and the clinical instructors, it was as if we were peers and we were all learning together, which was a great environment to be in. The other piece that I really valued was the simulation, the amount of simulation practice, the equipment that was accessible to us. I felt that I could directly see from before I started the program to after my confidence in the critical care setting, and just being able to navigate what should be happening, how to advocate for clients, and just the communication level that should be there.
Yeah, I couldn't agree more. The team we have in our little program is quite amazing, and not only the experience that our instructors have, but also I think the networking as well. Pediatric emergency can sometimes be a little bit of its own little world. So that networking, learning from people so experienced and so knowledgeable, it definitely puts a perspective on everything. And I mean, branching off of that as well is that simulation staff that we have as well, and the experiences the work that they put into, for us as faculty and for you guys as students is quite amazing. And that's great. Well, thanks, Kyle. So the last little bit I would love you to speak to is, again, reflecting back, before you're entering the program and as you were moving through it, is where did you envision yourself, where did you envision yourself going with nursing, and where did you think it was going to take you?
Yeah. My big plan was either education or leadership. And one of the other pieces that allured me to the program was the frameworks and the processes that would help with teaching and supporting new staff and preceptors and in the emergency department. And yeah, just kind of looking at different master's programs for leadership and policy type things.
Great, yeah, and that's why I was really excited to have you come and speak, because now working in a pediatric public health lens, it just goes to show that the skills you learn, in a pediatric emergency program can be extrapolated and threaded through any sort of either emergency or pediatric care that you kind of venture off into, and so that's amazing. Great.
Yeah.
Well, thanks, Kyle. Yeah, I appreciate you. I appreciate you coming, and I appreciate you taking the time out. And we'll see you around.
Sounds good. Thank you very much.
All right, thanks, Kyle.
Thanks, team. Thanks, Julie. And thanks, Kyle. It's always great. So yeah, if you have any questions about the pediatric emergency program or pediatrics or anything in general, feel free to shoot me an email, reach out. My email's on the screen, as well as mine as our program assistant. Would love to hear from you.